Hi, everybody, and welcome to week 3 of the ARC Michigan's Disability Public Policy webinar series. Thank you for joining us, and here's just a few items on the technical side before we get started. So if you're not familiar with GoToWebinar, you're going to want to locate the orange arrow in the upper right-hand corner of your screen. If you've joined via the app on your phone, the control panel is at the top or bottom of your screen. If you have any issues with your audio, you're going to want to go into the control panel, open up the audio tab, and do the sound check for your mic and speakers. Participants are muted for this presentation, but questions and comments can be typed into the GoToWebinar question window that you can find in the control panel. A link to the handouts has been shared in the chat area. If you lose your GoToWebinar screen, you're going to want to look for the blue flower icon in your taskbar, or if you're on an Apple device, it's an orange flower icon in your taskbar. Now I will hand things over to SherriBoyd, CEO and Executive Director at the ARC Michigan. Good morning, Sherri.
Good morning, Emily. Thank you. I want to thank everyone for joining us this morning. Our intent is to sort of give you some information about what the ARC does directly with the main areas of public policy that we're working on. So I'm going to get us started. You can go ahead and do the next slide. And Jill and CathyMcRae will be joining me in the presentation this morning. So here we go. The first thing that we wanted to talk about this morning was the behavioral health integration bills that are out there. If you haven't heard, Senator Mike Shirkey has Senate Bills 597 and 598 that are actually, he's trying to get them voted on before they adjourn here to go back and campaign in the summer. And the bills have to do with attempting to privatize our state's public behavioral health care system by sending the money to the Medicaid health plans here in Michigan. The ARC Michigan opposes this and has been talking about what we would have in, we would prefer to have the system do, but basically we feel like the privatization for, I believe it's up to 320,000 Michiganders who receive services from the public mental health system would put profits ahead of people. We believe that privatization would mean less person-centered planning, less choice, and a greatly reduced financial transparency. Next slide, please. Oh, and one other thing I just wanted to say about this. Yesterday, I think if people noticed, the Senate bill is actually Wednesday afternoon for the budget was voted out. You know, a significant amount of money, $500 and some million to help services across Michigan. There was a tie bar of about $50 million that wasn't approved. It's tied to passing 597 and 598, and the $50 million is allocated to help the mental health system get ready for this behavioral health integration if the bills were to pass. On the House side, there are bills that Mary Whiteford has put forward, and you can see the numbers on the screen, but the system would remain publicly funded and publicly managed, but it would send the money to one entity to manage the administrative functions that are necessary for Medicaid dollars. It would eliminate the PIHP structure, and this one entity would oversee the CMHs. And in her bill, the behavioral health and physical health integration is at the point of delivery, which is where many advocates have long said that's where it should be. And on the service side for folks with IDD, in practice, I think that happens for a lot of people. It doesn't necessarily happen for folks who have mental health or substance abuse issues. And with that, I'm going to turn it over to CathyMcRae, and she's going to talk about the direct care workforce crisis.
Thanks, Sherry. I'm CathyMcRae. I am a project coordinator here at the ARC Michigan. As you will see as we move forward with these slides today, I facilitate a direct care workforce group that's statewide. I also facilitate a supported decision-making group, which is also another statewide group. And I am the WIPA project coordinator. WIPA is Work Incentives Planning and Assistance. That's a program that helps people understand how returning to work will impact their Social Security disability benefits, as well as other public benefits they might receive. And I am the manager for the ARC Michigan Pooled Amenities Trust, which is a way for people to save money, set aside resources that will not be counted against their public benefits. So I'm going to jump right into the direct care workforce crisis, which has had a huge impact on an incredible number of people that the ARC Michigan represents. That's why it's one of the most critical issues that the ARC is working on. The coalition we facilitate is a group of advocacy and provider organizations seeking to improve the workforce within the behavioral health system. This group worked diligently to get the $2.35 an hour wage increase, which began as premium payment for those working through the pandemic, and now has become a permanent wage increase. We've had meetings with key legislators and staff from MDHHS to impress on them that while we are grateful for the $2.35 an hour increase, wages which average under $15 an hour are not sufficient for a workforce that provides the kinds of supports and skills that our direct care workers do. We've implemented with our coalition partner a one-click politics system to inform legislators about how important this issue is to us. Over 1,800 people have used that one click to make their voice heard. And if you haven't had the opportunity to do that, you can get there through our website by going to Current Projects tab and then clicking on the Direct Care Worker Crisis. Members of the coalition have testified on the crisis and the need for better wages to attract and maintain this essential workforce in our state. And we've placed editorials in various papers on this issue. We're currently looking to bring the voices of the people we serve to the attention of policymakers through stories about how the direct care worker crisis has affected them, their families, their loved ones. So if you or someone you know has been impacted by this crisis, please feel free to reach out to me. Next slide, please. So now I'm going to move to supported decision making. In Michigan, according to the 2017-2018 National Core Indicators, across the country, 43% of adults with developmental disabilities have a guardian. And that seems like a lot of people having guardians to me. But it is much worse in Michigan, where 81% of people with developmental disabilities have a guardian. We think it's important to stop guardianship before it starts, because it's very difficult to restore someone's rights after they have been taken away. That's the goal of the supported decision-making group that we help to facilitate. We try to do this by educating people at the front end of the process, particularly families of children with disabilities, school transition coordinators, special education teachers, and staff from community mental health services. Those are all the folks who are really at the front end of this process. During these trainings, we inform people of the many ways that support can be provided by means other than guardianship based on someone's individual needs. This group is also working on a toolkit that will make it easier for people to access the information and tools they may find useful to provide those needed supports. And we have recently received a small grant from the Center on Youth Voices, Youth Choices to bring on a group of youth ambassadors who will help give this information in the voice of the next generation. So we're very excited about that. On the legislative side of this advocacy issue, we've been watching and providing feedback on a group of bills supported by the Elder Abuse Task Force. On the slide, you see the House bill numbers. The Senate has identical bills. These bills would only affect guardianships that occur within the Estates and Protected Individuals Code, known as EPIC. Most guardianships imposed on people with developmental disabilities occur within the Mental Health Code. The ARC Michigan has long advocated for the same guardianship laws to be applied under each code. And initially, we had supported these bills. Next slide, please. Can we go to the next slide? There we go. Thank you. Oh, no, back. Supported decision-making too. Sorry, thanks. As introduced, the bills accomplished many of the reforms we'd like to see in the laws around guardianship, including a cap on the number of wards a professional guardian can serve, and mandating frequent and regular meetings between wards and guardians. However, proposed substitutes to these bills have eliminated the caps and watered down the language around meetings. Though we've been told more reforms will be coming in later bills, we do not feel the changes made by these proposed substitutes are significant enough to effectively improve the lives of people under guardianship or to provide greater protection from abuse and exploitation. We've made our position known to legislators and to the members of the Elder Abuse Task Force. As of today, the bills have not moved out of committee and the substitutes have not been adopted, but the bills are up for a hearing in the House Judiciary Committee this coming Tuesday. So we will continue to monitor these bills and any other bills impacting guardianship in Michigan. And as we move to the next slide, my colleague Marie is going to take it away.
Oh, there we go. Thank you, Kathy. Good morning. My name is MarieEagle, and I am also a project coordinator here with the ARC of Michigan. My main areas of focus are related to person and family-centered practices in Michigan, along with the use of self-determination. So part of my project is that we facilitate interviews with the Department of Health and Human Services Behavioral Health Division for people who receive community mental health services. Excuse me. The purpose of these interviews is to get a direct link to the experience of individuals and family members with person and family-centered planning. It's also to evaluate compliance with the home and community-based services rule, along with compliance with other state policies related to person-centered planning and self-determination. These interviews provide the department with really valuable data and a baseline for how the community mental health service providers are doing when it comes to person-centered planning, and it allows us to provide input for future direction for improvement of quality. We also facilitate the self-direction help desk in partnership with the department. The self-direction help desk is intended to be a one-stop for anyone who has questions related to self-determination in the state. And it can be found on our project's website at the ARC of Michigan. Excuse me. So folks can go and submit any questions that they may have, individuals, family members, folks working in the system, about the use of self-direction, whether it's about an arrangement that they have personally, or whether it is a system question related to something more technical. I partner with Laura Demuse from the department, the self-direction analyst, and we sit down and answer every single question that we receive. And if additional technical assistance is needed, we will then provide that on an individual basis. We also, as part of that help desk, are creating a frequently asked question So every question that we receive, we answer. We're having an FAQ developed that will be able to be found on that website, so folks can go there and have that as another resource. Next slide, please. Okay, so I also facilitate a monthly person-centered planning webinar series. So this webinar series is very wide-ranging, and it really covers all areas related to person-centered planning. It's free to attend. We hold it virtually over Zoom, and it is the third Tuesday of every month from 3 to 4 p.m. We record all webinars, and you can find all the recordings and all the PDFs of the presentations at our project webpage. We additionally partner with the department to plan the annual self-determination conference, which this year, unfortunately, is going to be held later than expected in August, and it will be a completely virtual platform. And in addition to the PCP webinar series, it's not on your slide, but starting with the new fiscal year, we will also be adding a parallel webinar series that is specific to self-direction, but it will only be quarterly as opposed to the monthly person-centered planning webinar series. And so with that, I'm going to hand it off to Jill.
Hey, thanks, Marie. I am JillGerrie, and I coordinate a project. Oop, back one, please. Yep, called Partners Advancing Self-Determination. And that's funded by the Michigan Developmental Disabilities Council. And you probably know this, but if you or your son or daughter are eligible for community mental health services, you are able to direct your own services through an individual budget. In the adult world, that's called self-directed services or self-determination. And in the kids world, it's called a choice waiver. Partners Advancing Self-Direction has been working for the past 4 years or so with community mental health organization teams. The teams include people with disabilities, family members, school personnel, financial people from CMH, supports coordinators, self-directed services coordinators, to really, those groups that really want to improve their self-directed services. And we had the pleasure of last year working with a terrific group from Lifeway's Community Mental Health in Jackson, Michigan. In addition to doing that, one of the issues we found is that people really in Michigan aren't able to control their individual budget like it was intended. So we started a work group that includes people who use self-directed services, supports coordinators, family members, and advocates to really look at, and Laura Demuse, who was mentioned earlier, who is the self-directed services analyst, to really look at how we can improve that. We're doing a little research this year, and ultimately what we want to do is give recommendations to the department in the second year next year. And then hopefully in the third year, analyze changes that have been made as a result to improve the services that people receive. Additionally, we hope to work with another community mental health this year. And if you keep your fingers crossed, we are hoping to provide presentations to people with disabilities and their family members about the updated self-directed services policy and its guidelines. We'll be doing that as soon as some issues are resolved between the community mental health organizations, the prepaid inpatient health plans or PHPs, and the department. So look for that soon. I'll be letting you all know. Other than that, I am all set, and I will pass it back to SherriBoyd, who's going to talk about conflict-free case management. Thank you.
Thank you, Jill. I just want to briefly mention conflict-free case management. There's a federal rule that all states will have implemented conflict-free case management by March of 2023. Currently, the the department restarted a work group that had been meeting many years ago, and is attempting to meet the rule on conflict-free case management by March 2023. It basically, conflict-free case management is making sure there's no conflict between money and services. And so what the federal rule is trying to do is to separate the case management or supports coordination from the money of process, so that they can truly do authentic person-centered planning and supports coordination based on the needs of people, and not be influenced by the money that gets spent by the agency they work for. The department, or as they're now called, VP HASA, is attempting to look at this issue within the context of both supports and planning, but also access and how you get into the system. So they're looking at a bigger group, or a bigger pie, if you will, of how do you make everything conflict free. So I am hopeful we will come to the end of the group soon and have a product. It's a big work group. There's a few advocates and a few family members, but there's lots of, CMH and PIHP representation, because of course it will impact how they deliver services. So if you want more information, the link is on this PowerPoint slide. The department has a page. If you're interested in joining the group, you'll be able to find out how to join there. I would say we're in the middle of the process, and that they are hoping to wrap this group up in the next 3 to 6 months. So thank you. And with that, I'm going to turn it back to Kathy.
Okay. So as anybody who is receiving supplemental security income can tell you, the SSI rate is well below poverty level. An individual receiving the federal benefit rate of $841 per month is receiving an amount that is less than 75% of the $1,132 a month, which is considered the poverty level for an individual in this year. So it's slightly better for a couple who will receive $1,261 per month, which is about 83% of the poverty level for a family of two. And while that rate for a couple is a marginal percentage more, people are still being penalized for marrying. The rate received by a married couple is $421 less than they would receive if they were both getting the individual rate. Additionally, an individual receiving SSI who marries someone who does not receive SSI may lose their benefit, and will likely lose their benefit, even if they have no other income other than their spouse's income. So the amount of allowable savings, which is called resources, is also reduced for a couple from what they would be able to save as individuals. An individual can save $2,000, and a couple is only allowed to have $3,000 in savings for the both of them. These limits have not been adjusted for over 30 years. Additionally, people receiving SSI can be penalized for receiving help from friends and family to pay rent or to purchase food. That kind of help is called in-kind support and maintenance. There are 3 bills that have been introduced in the US Congress to help address these issues. The bills would also increase the amount of the general income exclusion, which is currently just $20 a month, to $128 a month. So that's where you can exclude money that you receive as, say, a gift, or that you get from some addition to a savings account, or things like that, an annuity of some kind. And the earned income exclusion would also be raised in these bills from $65 a month to $416 a month, which means that an individual getting SSI could earn up to $416 a month without it impacting their SSI benefit. So these bills are called the SSI Restoration Act, and we have notified our state's congressional delegates that the ARC Michigan supports these bills. They are also supported by the ARC of the US. We will keep an eye on these very important bills and keep our fingers crossed that they pass, because that would mean so much to so many people being forced to live below the poverty level here in the state. So I am going to go to the next slide. So there's a few other issues that we are keeping our eyes on here at the ARC Michigan. There are several issues within home health that we're watching and have been working on, including the issues of providers getting paid for work that they perform on the day their client is admitted to the hospital. Initially, the department had said that they were not going to pay people for work that they did for an individual on the day they were admitted to the hospital. So in other words, if you needed to go into the hospital and your home health worker came over and helped you get dressed and prepared to go into the hospital, they would not get paid for that work. They have since decided, after speaking with the Centers for Medicaid, Medicare Services, they have decided that they can actually pay for that time, and they're working now on promulgating a rule with regard to that payment. So we're going to keep our eyes on that as well. And then we are also watching the policies and procedures being promulgated around electronic visit verification. We want to make sure that if that does move forward, that it is not invasive into people's private movements. And so then another issue that we're working on and that we're watching is freedom to work. So in Michigan, freedom to work is our Medicaid buy-in program for working people with disabilities, and it currently ends. So if you receive freedom to work Medicaid, when you turn 65 and become eligible for age-related Medicare, your Medicaid will end. And for many people, that makes work untenable. And a lot of people are working over the age of 65 these days. Even people with disabilities are working over the age of 65 these days, which is great. Although I would like to retire and I'm not quite 65, but that's another story. People who require medical assistance or require personal assistance while they're at work rely on Medicaid to provide those services. These are services that Medicare does not provide, which may mean that they can't continue working. So we would like to see those age caps removed. We've been working with Senator Irwin, who is interested in addressing the age cap and other eligibility issues for freedom to work Medicaid. Also, right now there is a bill in the US Senate. It is Senate Bill 1476, and that bill would entirely remove the age limit from the federal law, which would mean we would not have to take state action on it. Sherry, you're up next.
Thank you, Kathy. The last thing that we would just like to mention before we end the presentation and take questions is to mention that the state is in the process of the heightened scrutiny review for the HAB waiver. And about 6 weeks ago, the Region 5 PIHP list was released and put out for public comment. And there was probably 60 different places that people live in across the Region 5 area that needed to come into compliance with not having isolating features in their service delivery or for where they live. And what I mean by that is that people have access to the community, they have access to transportation, they can live a life that looks like yours and mine. So Region 5 comment period has closed, and any day now, the rest of the state, which means Region 1 through 4 and 6 through 10, their list of places that people live in and perhaps where they receive their day program services, that list will be received and people can make public comment about those places. It's going to be a huge list, maybe upwards of 800 different places. So when we know more and when the public comment period opens, we will definitely be sending things out about it so people can look up places and see if they're on the list and make comment if they care to. And so with that, we will end the formal presentation and be happy to take any questions people might have.
Thank you, ladies. We do have some questions, and the first one, talking about the PIHPs, what is the one entity in these bills where things would be managed as opposed to the PIHPs?
Well, of course, the advocates would want it just to be the department, but that's probably not going to happen. But it's called an Administrative Service Organization, an ASO, and it would take over the PIHP functions and operate to put them, be a flow through for the money and also make and work with CMHs to do the right thing and enforce, the contract and all the things that we care about. So it's the idea with Mary's bill is that it eliminates 10 different ways things happen in the state and tries to get at uniformity across Michigan, like so that when you go to one place, you can get all the same services that you could get in the next county. And I think there's also a belief that it would eliminate some costs and save money that could be put back in services.
Right, we have a couple questions about the DSP workers shortage and wages. It was mentioned that the $2.35 an hour would be made permanent. Does that mean it's not requiring a separate line item for accounting next fiscal year?
You mean in 23?
Yes.
I'm assuming. Kathy, I don't know if you want to tackle that or.
That is my understanding, but how that ends up getting communicated to providers is another issue. So
We could put if I can locate it where we're answering questions, there's an L letter out there about what entities have to do, and that's the latest communication. But in 23, I think we would assume it's still going to be a separate thing, but I don't know that we know that for sure. But we could certainly share the latest L letter that was put out about the 235 increase.
Next question about home health. The electronic verification visits, is that a federal requirement? And if so, when are states supposed to implement the EVV?
So yeah, it is a federal requirement. They were already supposed to have implemented it. But the feds are now looking at this issue again because they are becoming concerned about the intrusiveness of the systems being utilized for EVV.
Thank you. Next question. If the income exclusions are increased, would that apply to Medicaid spend down too? Because currently Medicaid spend down exclusions are the same as SSI exclusions.
I am not an expert in spend down, and it's very complicated. So I really could not answer that. at this time. It's something, if you wanted to know the answer, I do have a colleague who works in Medicaid eligibility who may be able to answer that for me. And I can run that by her. Her name's Bridget Heffron. She works for the department, and I'd be happy to run that question by her. She's much more of an expert in the rules around spend down than anyone else I know.
Thank you. And if folks have follow-up questions, you can always email the ARC Michigan, and we'll put that general email address in the chat for you. Follow-up question about the supported decision-making toolkit. Is there a timeline for its release?
Yeah, we're hoping to have it done by this October, I believe, is our goal.
Thank you for that. Our final question that I'm seeing right now is asking about services for youth and adults who are transitioning toward independent living. What groups are there, or how might people be involved? And we'll also drop the link to the sign up for the ARC Michigan newsletter into the chat.
So for folks who are transitioning to adulthood, there are a couple of really good organizations that I would recommend. The first one is Emily's crew at the Michigan Alliance for Families. I would definitely reach out to those folks. They have a ton of excellent information. Then I would also talk to your local ARC chapter. Those folks have boots on the ground in various locations and can talk about what specific services are available and where to find them in any given county. And then secondly, I would talk to folks at your disability network or your Center for Independent Living who have peer mentors and other folks who are specialists in independent living services. So those would be my recommendations to reach out to in terms of people who are making that age transition. So.
Right. Well, thank you so much, ladies. Sherry, I believe that's the end of our questions.
Okay, thank you. I want to thank everyone for joining us today just to get an update from the ARC's work in terms of public policy. Please consider joining us next week for our final public policy webinar series for June in 2022. Nicole Jorwick will be joining us from the Caring Across Generations organization at the federal level, and she's the Chief of Advocacy and Campaigns, and of course their mission is to try and bring all of the direct care work entities together to try to put value in the work that is done by workers in the aging community and the developmental disability community in terms of childcare. So it should be an interesting update and conversation from Nicole. Again, I want to thank everyone. Have a good weekend, and we'll talk to you real soon.